start with the health sector. Sindh government takes pride in having the best tertiary healthcare system in the country. Our public sector hospitals are catering to patients from all over the country without any discrimination. Sindh government started free ambulance service in 2017 under a public-private partnership named as Sindh People's Ambulance Service, which carried out its operation in Karachi, Thatta and Sijawal with a fleet of 85 ambulances till 2021. It was later transformed into Sindh Integrated Emergency and Health Services under the umbrella of the Health Department. Presently, a total fleet of 315 state-of-the-art ambulances is available with Sindh Integrated and Emergency Health Services. In remote areas of 11 districts, mobile health services were provided free of cost via 26 mobile hospitals, through which more than 2.5 million patients have been served in the last 5 years. The Jinnah Postgraduate Medical Center, the National Institute of Child Health, and the National Institute of Cardiovascular Disease combined have more than 4,000 beds today. In last year alone, 3.5 million patients benefited from the free of cost service. Total budget of these 3 hospitals has been enhanced to rupees 25.75 billion from rupees 1.9 billion in 2013 when these hospitals were transferred to the provincial government. Operational robotic surgical systems along with 9 CT scanners, 9 MRI scanners, 9 angiography units are functional. During financial year 2022-23, rupees 1.7 billion were provided for purchase of essential equipment for surgical complex of Jinnah Postgraduate Medical Center and for procurement of additional cyber knife with the latest model. Currently, JPMC possesses 2 cyber knives and 1 robotic-based surgical system. A state-of-the-art JPMC surgical complex was completed in 2020, which was inaugurated by Chairman Bilawal Bhutto Zardari.